Dennis Bly, our regional for West Africa, sorry, and our regional coordinator for East Africa, we have Dr. Odongo Shadrach. We have a regional coordinator for Central Africa. We have Zana Tresor. Our regional coordinator for Northern Africa, we have Zainab El Sharif. Regional coordinator for South Africa, we have Butle Dube. Then our chairperson for SCOPA, we have Michael Shoide. Chairperson of SCOMA, we have Waida Ali. Chairperson of SCOPE, we have Teresa Sindik. Chairperson of SCOPUB, we have Ashley Kamau. Chairperson of SCOHI, we have Dorothy Osahon. And then we have our ex-officio, who is Cinnamon Nyagaka. Our ex-officio too, we have Victor Femi Lawal, and our exec French translator, we have Pierrette Nyamador. Thank you.
Okay, thank you very much, Martha.
Yes,
Now,
Mr. Vice President, your hand is raised. Mr. Vice President, I can see your hand is raised.
Okay, thank you. It's because of I think the restriction to allow the participants to be given permission first by the host. So here's the deal. I'd request that as we are joined in this meet and call, we are colleagues, medical students, and it's important that we map and know how many countries are represented in this call. So maybe I hope the Secretariat can take note. And while you're doing the introductions in the calls, please note of your country so that at this point is when we can know, like, where are we coming from, which. Yeah, thank you.
Okay, yes, thank you, Mr. Bond, for sharing that. I think we can use the part for that. You can introduce yourself using your name, Medical Student Association, and country. You can introduce yourself and type in the chat box. So, moving forward, I'm going to call on the chairperson for Standing Committee on Professional Exchanges to please unmute her mic and then give us an overview of our committee. Thank you.
Hello, am I audible?
Yes, you are. You can go ahead.
Thank you. Thank you. So, good evening, everybody. My name is Teresa Simbik. I am the current chairperson of the Standing Committee on Professional Exchanges. So, simply, if you want to know more about scope, you just think about a group of students that are... Sorry? Can I continue? Sorry.
Sorry for the interruption. Yes, you can continue.
Okay. That is focused on fostering global collaboration, knowledge exchange, and cultural integration. Here, you can come and join us, whether you like to exchange. Exchanges can be in different way, shape, and forms. whether they are virtual exchanges, cultural exchanges, or even physical exchanges. So if you, our mission is to provide students with unparalleled opportunities to gain hands-on clinical exchanges, broaden their horizons, and develop a global perspective of healthcare delivery. So also SCOPI is the committee that is responsible for the health educative schools that basically is where FAMSA creates programs to educate on various topics in our schools. So as I said before, if you like and if you are more into global collaborations and knowledge exchange and cultural integration, please come and join SCOPI.
Okay, thank you, Teresa, for your input.
Thank you.
Okay, I would like to welcome the next chairperson of SCOPA. If Mr. Michael Shoide is in the call, please give us a brief overview of your committee. Mr. Michael, is he in the call? Okay, then I don't think he's in the call. We'll go to the next chairperson. Oh, okay. Miss Wahida Ali, if you're on the call, please can you give us a brief overview of the SCOMA committee, please?
Okay, thank you, Aisha. Hello, everyone. My name is Wahida Ali. I'm from State University of Zanzibar. My medical student is Tanzania medical student. And currently I serve as FAMSA SCOMA chairperson. Hope I'm audible. Can you hear me? Hello.
Yes, we can hear you.
Yes, you're audible. Okay, thank you. So about SCOMA, I think this is very interesting standing committee in FAMSA because it is about how we are going to make skills doctors. So shortly, I can say medical education about SCOMA, it's about education and research. So you as a doctor, you need to treat your patient, but before you need to conduct to know the diseases, how it is going to occur, what the things happen in your community, in your continent and world as well. So by in this SCOMA, we are going to in the making of sorry. Sorry.
Sorry for the interruption. You can go ahead.
Okay. So in our standing committee, we are going to encourage the training of medical students in research principles and procedures. Also, we are going to emphasize and stimulate original thinking and initiatives among medical students and coordinating medical students in research and appraise its practical applications. And finally, we are going to collect and disseminate original findings. So if you are interested in education and research, if you want to be a good doctor, if you want to be a good researcher, so you can join us in FAMSA SCOMA. we will help you to achieve your goals, and we can work together to build a gigantic FAMSA SCOMA. So you're welcome. Thank you.
Thank you, Wahida, for your input. I would like to welcome the next chairperson of SCOPUB, Ms. Ashley Kamau. The floor is yours. Ms. Ashley Kamau. Okay, I don't think she's in the call, so we'll go to the next person, the chairperson of SCOHI, Ms. Dorothy.
Good day, everyone. I'm Dorothy Osaho from the University of Benin Medical Students Association, Nigeria. I'm the chairperson for the Standing Committee of Health and Environment. The Standing Committee of Health and Environment is a dedicated committee within FAMSA that aims to advance health and environmental sustainability throughout Africa by means of community engagement, advocacy, and public awareness. The mission of the committee is to tackle public health challenges, environmental problems like climate change, and their interconnectedness. So it's going to serve as a foundation for skill enhancement and enabling students to advocate for positive transformation in African health and environmental fields. So if you're interested in carrying out projects to help raise awareness on vital health and environmental issues in Africa, please do well to join Standing Committee of Health and Environment. Thanks.
Thank you, Ms. Dorothy, for your input. I'd like to call out also the chairperson of SCOPA. If you're in the call, the floor is yours. And the chairperson of SCOPUB, if you're in the call, please, the floor is yours. We haven't heard from you. Okay, so I don't think they're in the call. So we'll go on with the next agenda, which is overview of the application process. I invite the Vice President, Mr. Bonaventure, to go on.
Okay, thank you, Martha, for the welcome.
Excuse me, sorry for interrupting.
Sorry, yeah.
There are regional coordinators also,
Okay,
regional offices also. So
thank you. Okay.
sorry. Martha, I think it's slipped your mind to call on the regional coordinators. You can go ahead, please. Thank you.
Okay, I'm so sorry. So I'd like to introduce the Regional Director of West Africa, Dennis Bly, for your input. Thank you.
Thank you very much, Martha. Greetings, everyone. I'm Dennis. Everyone, I'm Dennis. I'm Dennis Chelate Blake Jr. I'm from Liberia. My university is the University of Liberia, and I'm the regional coordinator for West Africa. So constitutionally, as the regional coordinator, my role centers mainly around working with MSA presidents and FAMSA officers, where your medical student association is going to select a person who will represent you at the level of FAMSA. We say they are FAMSA officers. And then with the other executive council members to ensure that in the region of West Africa, we organize programs that will promote the aims and objectives of the entire federation. So I just want to run over the aims of the federation so that you know if you join West Africa region, what are those things that we're going to be trying to promote, that the federation is all about. So constitutionally, the federation aim number one is to project the image of the African medical students both on the continent and the international scene. So if you're with West Africa, for example, Medical Students Association in West Africa are going to come together to see how we can organize projects and programs that will help support this in what is going to be to have impactful programs. It's going to be to get more students involved. It's going to be to partner with more people out there, organizations, and so forth. So these are things that we're going to be doing to do that. So it also has to enhance and broaden the general and special education of member medical students in and about various parts of Africa as a special furtherance of the diligent efforts of medical schools and thus to contribute to the improvement of medical education. In other words, as the end, we want to improve medical education in Africa. So at the level of the region, because this is like the general goal, but the EC sits up there and it can add, functionally, it will be difficult task if we just have an EC that is linking with every region. So it's like more of a breakup part. So we have regional teams set up. So there'll be an entire West African regional team. And as you go to the constitution, there will be several other aims. So I'm just saying, if you come, we're not going to just be working. We're working with what the constitution has. So that's where our roles will be. So there are other positions. Like for the code that we have now, we're advertising for 6 different positions. So I'm the regional coordinator. We're advertising positions for other 5 regional coordinators, like 5 regional coordinator for internal affairs, who deal more with the Medical Students Association here, 5 regional coordinator for external affairs, who is going to be dealing with other partners out there, and then we'll have someone specifically for capacity building. Like we said, we want to improve medical education in Africa. We want to work with medical schools and medical students. So there's one specific person for capacity building, and then there will be a regional secretary. There's going to be a finance officer, and then we'll have the translator. As of now, the priorities having French translator, but we all know we could have translators for other languages as well. So basically, that's about the regional council. So I look to your applications. I look forward to your questions. And as your questions come, we might explain further. So thank you all. Thank you, Martha.
Thank you for your contribution, Dennis, Mr. Dennis. I'd like to welcome the next regional coordinator of East Africa, Mr. Odongo Shadrach. The floor is yours.
Thank you, Martha. I'm Odong Shadrach from Uganda. East Africa, we have 12 countries, Ethiopia, Uganda, Kenya, Tanzania, Somalia, Burundi, Rwanda, to name but a few, Eritrea. So please, we have a regional council and we call upon interested people to come and work at the regional council. As my predecessor said, we believe that as a team from Tanzania, Kenya, Uganda, Rwanda, we shall do capacity building. We shall hold a regional conference. We are going to help standing committees be effective. We hope to get a translator of French and Arabic, and we really think we are going to have an exchange where we are going to physically meet as East Africans, put that in the plan. We hope to reach each MSA in East Africa. So we have a lot. Our plan is big, and we believe that as a team, if we come from East Africa, MSAs come together, we believe we can achieve a lot. So please apply and work with the East African Regional Council. I've been there for a year, and it is so interesting, it is so sweet and so beneficial to a student. Come and work with the East African Regional Council, please, if you're in the East African region. Thank you very much.
Thank you, Mr. Odongo Shadrach. I would like to welcome the next regional coordinator for Central Africa, Mr. Zana Tresor. The floor is yours. Mr. Zana Tresor, if you're in the call. Okay, in the meantime, while we're waiting for him, then we'll go to the next regional coordinator. For Northern Africa, Miss Zainab El Sharif. The floor is yours. Miss Zainab El Sharif, if you're on the call, please. Okay, I think she's not available. We'll go to the next one. The regional coordinator for Southern Africa, Miss Buhle Dube, if you're on the call.
Thank you, Miss Aisha. Good evening, everyone. My name is Buhle Dube. I'm from Zimbabwe. My MSA is Zimbabwe Medical Students Association. I'll serve as the regional coordinator of Southern Africa. So we are saying the FAMSA Southern Africa Region Council is composed of medical students from 8 countries, which are Namibia, Zambia, Zimbabwe, South Africa, Malawi, Botswana, Lesotho, Swaziland, and Mozambique. And then we are saying as a council, their aim is to carry out the objectives of FAMSA, which is actually listed in the FAMSA constitution, ensuring the inclusion of all medical students and other health disciplines. And then we are saying as FAMSA, as the Southern Africa Regional Council, what we have to do, first of all, the regional coordinator is responsible and accountable for all activities of the regional committee. And then as a committee, our role actually involves that we have to work with the Medical Students Association presidents, FAMSA officers, executive council members to organize programs and promote FAMSA aims and objectives. And we also have to prepare and present an annual plan of the regional committee of FAMSA executive board and submit written quarterly reports of FAMSA activities in their region. And we also have to give recognition of the best performing MSA every 4 months and host all callouts for vacant position in regional committee, which we're doing right now. And we also have to organize regional conference and workshop on approved themes in the Southern African region. And then in the Southern Africa region, we are saying our structure is actually composed of 8 positions. And then the first position, which is the regional coordinator, in which I'm the regional coordinator, which is a medical student from Zimbabwe. And then we also have to have the regional secretary who manages communication within the council and within external stakeholders. And we're supposed to have the financial officers who manages the council's finances, including budgeting and financial reporting. And we also have to have the vice regional coordinator for external affairs. This one manages council relationships with external organizations and stakeholders. And we also have a position for the vice regional coordinator of internal affairs. This one focuses on the internal functioning of the council. And we also have the vice regional coordinator membership and capacity building. This one manages the retention of council members, and organizes capacity building workshops and training for members. And then lastly, we have the MSA officers. These are the liaise between the council and individual medical students association from the 8 different countries that we have in the southern region. Thank you very much. I look forward for your application and for us to work together as we take FAMSA to new heights. Thank you very much.
Thank you so much, Ms. Dorothy. So there has been a slight change in agenda. I would like to welcome the ex-COHI chairperson in FAMSA for the year 2020 to 2022, Dr. Tasneem Abel Mahmoud, who is currently an intern doctor and graduated from the University of Khartoum. Welcome, Dr. Tasneem. She will walk us through why we should join FAMSA and the opportunities it presents. Thank you.
Thank you. Hello, everyone. Am I audible?
Yes, you are.
Thank you. Hello, everyone. I'm Tasneem Abdel Mahmoud from Sudan. I graduated from University of Khartoum Faculty of Medicine. My MSA was FAMSA, Khartoum Medical Student Association. I served in many positions in FAMSA. I firstly served as the local officer for SCOHI, then vice regional coordinator for membership and capacity building, and then SCOHI chairperson for the term 2021 and 2022. And I'm pleased today to talk about why you should join FAMSA. Let's start. Next slide, please. So first of all, FAMSA community is one of the most welcoming and warm communities. Is there a noise? Hello?
You can continue now.
Yes, we can hear
Okay.
you.
Okay. When I first joined FAMSA in 2020, I believe, the community of FAMSA was very welcoming. I got the chance of meeting leaders from all over Africa, and I definitely learned from them. Many students from all over Africa are ready to help with anything. So, like, I met people from Nigeria, from Gambia, from many countries in Africa, and they were all ready to help. So this is for applicants or prospective applicants. Please don't fear applying. You will find help and you will find assistance during the application and even after it when you are in the position. So don't feel afraid. Just go for it and make sure you are always open to discussions and to learn from others. Next, please. So FAMSA is not just about professional development. I know that we are all doctors. We all aspire for professional growth and like gaining experience, especially for those who are interested in public health, but not exclusively for them. So the benefits of joining FAMSA, we can categorize them in 2 categories. There are professional benefits and there are personal benefits. Regarding the professional benefits, there is the capacity building opportunities. There are trainings, there are workshops, and there are like also all workshops from international organizations other than FAMSA. I remember when I was in charge, there was a capacity building session that was facilitated by IAS, International AIDS Society. So that was really a very amazing opportunity. And there is also networking opportunities. You will have the chance to network from leaders all over Africa, as I've said. I met, like, to mention one of them, Abdul Hamid Baba Tundi, who was a scholar, and I really learned a lot from him regarding research. I also met other leaders from Gambia, from Nigeria, Kenya, Togo. So you will get the chance to network and expand your network. Another thing is leadership. For those applying for the central committee or even like to occupy roles like local officers, they will get the chance to develop their leadership skills, like whether it's theoretically by capacity building sessions, by trainings, or by just experiencing the situations and learning from them. One of the most interesting thing is that scholarships. I applied for when I first applied for FAMSA, I just wanted to serve. And that's the main goal of volunteering. I wanted to serve like on a bigger scale, not just in Sudan. I wanted to know about people, for example, in Nigeria, in Tanzania, and how to conduct a medical education sessions that will benefit people from all those countries. And I wanted to learn about health system in other African countries other than Sudan. And surprisingly, when I applied for MPH, Master of Public Health, I found that you can get scholarships because you serve in such organization, international organization, and it it you know it elevates your score. It adds more points. Also, you get the chance to be part of many projects taking place in many countries. For example, when I was the SCOHI chairperson, we conducted breast cancer awareness sessions, and we conducted the kidney awareness sessions, chronic kidney disease awareness sessions that took place in Tanzania and Nigeria and Sudan at the same time. The personal benefits are soft skills. You get the chance to do presentations, to write concept notes, even if you don't know, like you will know, and you will get the chance of knowing new people and new cultures, and that's really amazing. It's amazing to know about other countries, other students' lifestyles in other countries and cultures, learn about different healthcare system and opportunities in other countries. For example, like I met many students that are interested in learning in another countries, like doing exchange, for example. So like most of them would think about Europe, but fortunately there are many countries in Africa that are good for such experiences. For me, Tanzania is one of the good countries. You will get the chance to learn about how healthcare system is operating in Tanzania through FAMSA, and you will get to know about healthcare system in other countries and the weaknesses, the strength, and everything. Next slide, please. My story with FAMSA, as I've said, I served as local SCOHI officer, the North Africa Vice Regional Coordinator for membership and capacity building. We basically try to increase, membership in the North Africa region, and fortunately, we succeeded to add Libya. It was the first time that there was an MSA from Libya. I also served as SCOHI chairperson. Well, this journey helped me grow personally and professionally. In the past, I didn't write a concept note before. It was the first time when I was like a local SCOHI officer. I learned how to write concept notes, how to write a project plan, and how to apply it, how to monitor, how to write the result, and how to write the report. Those are very important skills, and it helped me to grow personally. I got the chance like to know how to network, how to contact other people, how to benefit from your relationships, and like how to see things from other perspectives. And I learned about new styles of leadership, stuff like that. And it also helped me to get university admissions. I applied for, as I said, for MBH, and I got accepted in most of the universities I applied for because they were all interested about students who are active at their continent, and they did work that benefited people in need. And I also got for conferences. I got invited for European African Health Development Conference, and I got invited to a lot of conferences just from LinkedIn profile. I wasn't even applying, saying that I'm currently serving as a SCOHI chairperson. They just went through my profile, then invited me for maybe two conferences, and we got the chance to present our research that we did with other SCOHI members in International Kidney Conference. So you will get the chance also to learn about research and about how to publish research, and you can actually do a research with many countries. Like our research was conducted all over Africa. We collected samples from all over Africa. So thank you. I hope I didn't take long time. So thank you for listening. That's it. And if you have any question, please do contact me.
Thank you so much for the wonderful presentation. It's quite inspiring. So maybe the Secretariat.
Thank you very much for the presentation, Dr. Tasneem, and thank you for sharing your wonderful experience with us. Definitely, taking part in FAMSA is like it's something you can't describe in words, but you were able to formulate words and put them into sentences to describe how your experience have been. So that is very wonderful, and thank you very much. Now we will move forward to the next item on the agenda, which is overview on the application process, on the FAMSA application process. So firstly, we would which Mr. Bonaventure, our Vice President, would be taking. But Mr. Bon, you would start with the technical working groups, which we skipped earlier. Then you would continue with the overview of the application process. Thank you very much.
Okay, thank you so much.
Yours.
Yeah, thank you, the Secretariat, and it's been quite an inspiring session. I'm also inspired to learn that the journey in FAMSA is actually one of the best decisions I've made in my career. And today, yeah, like we are here to help each other to try and become better healthcare providers, better leaders, and even advocates. So I'll start with making a presentation about the technical working groups. I don't know if the HQ is able to share the technical working groups, just like the photo technical working groups we have. I'll give a brief overview about what each entails to the audience, and people can make their informed decision about the application that they are going to make. So while they try to put them up, I'll speak. They are quite clear. So far, we'll have 8 technical working groups, and I begin with the first, just to give like a general overview about these groups and why we think like they are quite important, because we've heard that we have standing committee for population activities, we have SCOPA, we have SCOHI, all this, and it's important now that we have these technical working groups because they are vital in addressing the emerging global health trends, and of course to equip medical students of our continent with the knowledge and the skills that are required to tackle the real world challenges, that health challenges that are existing. And at the same time, they foster interdisciplinary collaborations. So you might find you're doing a project even outside FAMSA with like maybe pharmaceutical students. Yeah, so and these working groups really encourage collaborations among students, among people from different cultures, people from different regions of Africa. So as of today, I'll begin with the first technical working group. The first technical working group is yeah, I think this fair enough. You'll find this on the on the application form. These are the technical working groups. Sorry about the quality of the photo, but if you are able to read, the first technical working group is HIV and AIDS. And what we have, it's like a major public health issue since the 1985, and we obviously move year by year trying to mark different milestones that have been achieved in different in the treatment and prevention of HIV and AIDS. And Africa, it's one of the biggest public health challenges in different regions, depending on the existing determinants of health. And then, of course, we empower medical students on how to address stigma, which is the most important thing that you need to address with regards to management and addressing HIV and AIDS. The ARTs, what are the existing policies, what are the existing works that are being the global trends regarding HIV and AIDS. For example, now we have the UN AIDS, that's the United Nations Committee for AIDS, and that is emphasizing now the target of 95, 95, 95 by the end of 2030. So that is where we center our projects around, with objectives to increase awareness and advocacy for HIV and AIDS and prevention. I'm sure you guys like have all these, December 1st is last HIV Day, World HIV Day, and to equip students with skills. Of course, this is the most important thing, advocacy, and promote even research in different regions and know what is happening. Are we having a shortage in data and evidence from this region? So, for example, we know that just like less than 1% of global research comes out of Africa. So you see like how much we can go as a continent if we venture into these technical working groups and doing different projects. At the same time, we need to understand the differences between advocacy, the differences between campaign and activism. So all these things are different, and all of them affect healthcare, can affect healthcare outcomes differently. And today here as medical students, we can engage in all of them at once or at different times. The second technical working group is health, digital health, and innovation. So as we know, this has been a broad topic. I don't know in your country what is happening, but coming from the highest policy making platform that is with 47 member states, I know digital health and innovation is one of the biggest priorities before 2028 in the African continent. And these technologies are transforming healthcare delivery from telemedicine to AI-based diagnostics and technologies. And therefore, it's important that as students, we have to understand and adapt to these changes. And we are the most suited generation to engage in such technologies and innovation. And we know like globally, we know like AI, mobile health apps, electronic health records, like these things are really appreciated, and we are trying to make the world a village, from a village to make it to just one household. Yeah, and it's important that we venture into digital health, yeah, as students. And of course we'll train using digital tools, engaging in competition. That's by encouraging people to innovate and collaborate in, I don't know if you guys saw like Afro Hack last year, and we had winners who came from, I think, Kenya. There was an Afro Hack hackathon competition. Yeah, apparently I participated. Yeah, but we couldn't succeed. We were like number 5 there, but we worked on our projects. We learned, and then we took the same project to the Red Cross, and then from Red Cross now we won like a conditional grant. So those are the things we want to encourage students to venture into now. Since I have the platform, I have you there. We give you the platform to engage in digital technology. And the most important thing is, of course, to promote ethics in technology used in medicine, because there are advantages and disadvantages. The third working group that we think is important also, there's climate change and planetary health. All of you guys were seeing debates, COP 29, COP 29, COP 29, all those talks. And they are saying, like, Africa continent, you know what? You people need to adapt to these changes. They don't want us to mitigate what makes Africa. Of course, we are a least contributor, but the most significant thing is, like, we are the majority we are very vulnerable in the event that there is a change or drought or famine. People die. Like, we have a lot of public health implications, since, like, close to 60%, statistics, 60% of the African continent, like, they depend on farming. Most of the people stay in rural areas, so we know the biggest role that climate does, and any climate change directly will impact health through, of course, we know extreme weather events. I can give a testimony from the country I come from. We had extreme floods last year. There is vector-borne diseases. We are training with infectious diseases as a continent. We are having even people trying to go to the like, this movement between the human being to the forest, and then people consume those animals that have those viruses, those infectious microorganisms. They get new hosts. That is how actually we are having and generating pandemics. So we need to address this. And planetary health, of course, there's environmental degradation across. So we, the medical students, we need to integrate into this our clinical practice. Of course, we know the global trends of COP 29, COP 29. We know how the global these global philanthropies, sometimes they come there, it's all talk and talk and talk. But now, to put it on ground, we need now to understand the health impacts. We need to advocate for climate resilient health systems in our continent, and also promote, of course, sustainable practices, because we understand we are sometimes in resource constrained regions. Pandemic preparedness is the fourth technical working group. Yeah, we know what COVID-19 did to Africa. We know what COVID-19 did to the world. COVID-19 exposed our public health and emergency response systems in our continent, to the extent that we had to receive masks through Ethiopia, and these masks were distributed to different countries. Like, it was so a show of shame, I want to say, for our continent, because we don't have existing global health strategies in our continent with regards to collaboration, with regards to this resource generation, that solidarity, intersectorial collaboration, to just have this, to be prepared for any pandemic or epidemic that is coming up. But I'm quite happy with what has happened recently in Rwanda, in the Congo DR, Central Africa, where we've been having outbreaks, and we had outbreaks of global health emergency. We have Marburg virus disease that was in Rwanda, and Rwanda was able to contain it well. And these are the people we need. We need people from Rwanda to tell us, hey, what are the best lessons we can learn from how the Ministry of Health, in collaboration with other stakeholders, did for us to respond well to this pandemic or epidemic. The same case, we have Marburg virus disease in Tanzania. I was very happy and impressed on how the president was able to respond to such. I don't know if that is the most effective, but one thing she addressed was attaching that governance is key in the healthcare system. The pillars among governance is one among the pillars, and she was able to respond. I saw some action being taken, and yeah. So such are the trends that we need to know. And under this pandemic preparedness, we have other topics like vaccines, epidemiology, surveillance, infodemics, and this misinformation and disinformation, and all those. So you can see a variety of the projects that we can do. We have AMR. I think if you people were able to follow last year's the UN 79 year that happened in New York, we know that AMR was given a highest priority, and there were new new policies and new diplomatic recommendations that were made with regards to AMR. And we need to bring those things directly from the global diplomatic and policy-making platforms like the UN and these big bodies directly to the community, because we, in the communities where the effects are felt, and our problems begin and end in the communities. That's why as medical students, we play a key role in ending these things. So we have like AMR, under One Health, we can do very good projects. WHO, FAO, and OIE, I think they are working together to adopt like the One Health cornerstone towards ending health challenges in AMR and zoonosis by 2030. So to speak about, there's another important thing, health systems strengthening and financing. In our continent, I just have to speak about universal healthcare coverage. And this is the most important topic that is happening. You know, the thing is, people talk about these things, but the effect is not felt by the people. What is happening on the ground? How much can we do as medical students to influence universal healthcare coverage, for example, to address any inequities that are existing in the healthcare access that are revealing systemic issues in our continent? Yeah, so we know that. Sorry?
Mr. One,
Sorry, yes?
I'm very sorry for interrupting, but
It's
we
okay.
want to like round off quickly, and we
Yeah,
are
sure,
yet to
sure, sure.
move into the
Sure.
main activity. So I know
Yeah,
there is a lot to share definitely, but then let's
sorry.
try
Yeah, yeah,
and
yeah. Okay, okay. So there are
let's try
remaining
to
two
press time.
okay, thank you so much. So there are two remaining technical working groups. That is the non-communicable diseases, and we have NTDs and neglected tropical diseases. So yeah, of course, we have to. These are the biggest challenges, of course, especially the communicable diseases and NTDs in the low and middle income countries. So we need to join these technical working groups and yeah, have an opportunity to represent and showcase our talents and gain more skills. So I'll move on to the next. Sorry, I'll move on to uh, share my screen a bit with regards to application process. Sorry, let me share. And we do that quickly because it's more of a subjective process. So I'll use false information, for example. Um, I don't know if my screen is visible. Let me turn off my video to ensure smoothness of the presentation. Yeah, so I'll have to turn off my video. Okay, thanks. Are you able to see my screen? Sorry.
Yes, we
Yes.
are able to.
Okay. So it's a live screen, and I'll move through quickly because the meeting time is quite okay, so the first is this is an application call for the central committee members, technical working groups, and subcommittees in different that is standing committees for the term 2024-2025. So you get to serve like a period of by the end of 2025 this year, that is. So these are the instructions. I think they're self-explanatory, and it's important to understand the selection criteria and note of the deadline, and then there is selection and evaluation based on motivation, experience, gender, and regional representation. And then you also feel free to apply. Of course, you're encouraged to apply if you feel like you don't have relevant experience, because the experience is also very subjective. It's not like it's more of provisional. It's not fixed. And then there's a mental health note. This is quite important for all medical students, that you have to take note of your commitment before you proceed to apply. Then there are toolkits to help you there, useful resources, the constitution, why when you're applying, you go through the website and try to understand more background information about FAMSA. So I'm going to use like a dormant email of mine that I rarely use. So yeah, so I'll move with this and then proceed. Okay, so here is it. Please feel free to interrupt at any point. My technical issues might occur or anything that you don't understand. So I can choose the committee I'm applying for. For example, let me say I'm going for Skopje. Okay, next. Then dear applicant, below are the positions that are available. Then I proceed to apply, for example, public health officer. And I proceed to do, so would you like to be considered for other roles if your preferred position is unavailable? You match yes, and then proceed to the next one. So motivation statement. I know I wouldn't be able to go through this point here because I have to have like 1,000 characters to allow me like move through this. I don't know if this will work, but yeah. So here's the thing. You have to fill that, and then there's resume. Resume is like curriculum vitae, like CV. You can upload, I think, maximum 2 pages to show the relevant experience that is relevant to the post you are applying or the post you're applying or the office or the position you're applying. Yeah, so I'll have to refresh the let me clear form first. Yeah, then I'll go again. There's one that I need to show you that shows the MSA president technical working group. Next. Yeah, so you choose one there. I can go with pandemic preparedness. Next. I still need to move through. Sorry. Let me get something and paste here in a minute. In a minute, please. Okay, so it's proving to be difficult. Let me move with this. You will find a post for general information that is supposed to be section 2 of 19, and you'll be able to put in your name, full name, that is the official name, and then working email, then your gender or sex, and then WhatsApp contact, which you prefer to, of course, put there, and then we would like to publicly apologize at this section of gender and sex because I don't know, the form couldn't allow us the timing, of course. If you prefer not to put any gender, you might put your false gender if you feel like you want to identify with any other. And then your WhatsApp contact, the region from which you are coming from, and then the country of study, it's important also. And then, of course, for what we said as regional like representation, your MSA, Medical Student Association. So that is the medical school you are from. You write that down. Who is in charge of your medical student association, the medical school association you are from, like the president name, and then you put the president email, and then the president WhatsApp contact, and then an introduction letter. An introduction letter from the president could be like I nominate Bonventure Machuka to this position to okay. sorry for the interruption. Okay, so the MSA introduction letter from the MSA president, I nominate Bonventure Machuka to this post, for example, maybe to this technical working group, and then blah, 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 because of this and this, I've known this and this, and then they sign, and then you upload the file here. It's quite simple. And then there are available committees. Of course, you have to move now. That is where we were. For example, you want to move to North Africa Regional Council, you want to do technical working groups or SCOPA, and then from there, you'll now proceed to put in why you feel like you want, attach your resume, and then proceed to write 1,000 characters to 2,002. And then, yeah, you finally upload. It's quite simple, and I like to leave it there just to take questions, please. I need to take questions from your side. Okay, yeah, I think I'm seeing a screen share from the HQ. So please proceed, and where there will be clarification needed, I'll please clarify. So let me welcome the questions, general questions directly. Please, questions from the participants. Yes, Korede, you can unmute. And before he speaks, please note that you can direct the question to anyone you feel like. Thank you. Okay, proceed, Kolede. Yeah, please, you can put your hands up because there's that order.
Right. Thank you.
Okay.
Good afternoon. Good evening, everyone. My name is Korede, and I'm sorry for the background noise. I'm currently on a journey. I just wanted to ask if the technical working groups will be working separately or independent of each other, or if they're going to be working in partnership or in collaboration with other technical working groups or standing committees. I wanted to clarify this, please.
Okay, thank you. Yes, I have to respond. Yes, definitely they are working separately, they are working independently, directly from the office of the vice president and other involved executive members. Yeah, so you'll be very independent, but if you wish to do a collaborative project with these standing committees, you'll always do a project if you feel like you want to collaborate. Yeah, no restrictions, but you're working independently. Thank you. Okay, next question. I hope that is answered. You can lower your hand, Kolede. Thank you. Next question is Abdul Hafiz.
Hello, good evening. Can you hear me? Hello.
Yes, we can hear you. Thank you. Go ahead.
Okay. Okay. Thank you very much for the presentation. My question is, I don't know much about the structure of the technical working committees. I don't know if you can highlight on the structure of the committees. Are there roles available in each of those committees, or it's just going to be a conglomeration of people working together to achieve a certain goal?
Thank you.
I don't know
Thank you
if you
so
get my
much.
question.
Yeah, I do get it correctly. Thank you for your question. So to respond to your question, we decided to have people to join into the technical working groups, and once we have the full quorum, we have like up to we have like up to 6 positions that people can participate. We'll have the lead program officer. We can have the SG of the technical working group, vice chairperson, media graphic officer. We can have finance officer, whoever like wants to take the role, and research and policy officer. So there are posts that people will select themselves democratically on how they feel like. We didn't want to dictate the positions in the technical working group. Thank you.
All right, thank you very much.
Next question is Jacob.
Hello, please, can I be heard?
Yes, please.
Okay, so my name is Debo Jacob from Ghana. With respect to FAMSA and its operation, I've had the opportunity to serve on previous administrations, but the biggest challenge for us as a country, it's FAMSA being known in our country. Is there any plans by this administration to work around that and see how we could spread FAMSA to the countries? The reason being that FAMSA usually works with the various MSCs. I mean, a specific MSc. I do talk to colleagues that I know, but it looks like the interest is no. So we were having a conversation with the previous administration as to how to make it big in order to go and talk to other MSAs in the country so that it beefs up the interest and the knowledge of the people in the country about FAMSA for them to also join in the activities appropriately. I don't know whether it's appropriate for this meeting or not, but is there any plans like that so that we could help beef up the interest and the knowledge of FAMSA in the country as a whole and all that? Thank you.
Okay. Thank you so much. Thank you so much for the question, Jacob. Yes, correct. Part of the, even from our campaign, and part of the biggest like themes we are prioritizing is visibility and direct impact as FAMSA. And we want to do a remapping of FAMSA with regards to student and MSA reach in different countries. Thank you so much for raising your concern. Yes, this is what we are working from March of 2025, and we hope by the GA we'll be having a new map of FAMSA that is well covered. Thank you so much, Yusuf, and please, I hope have you joined our FAMSA communities and the different regional groups? Please join if you haven't, and I'm requesting the secretariat to please paste the links, or people can join to their different they can join the community and then join different regions and then be involved in activities there at any point. All these things are casted, and follow the social media. And we'd like to be in contact, Yusuf. Thank you so much. I hope I've answered that correctly. Next question is Hilary. Hilary, please.
Sorry, I'm looking for Hillary to allow her to unmute, but I don't think her hand is raised, right? Okay, sorry, I've seen her. Sorry. I will be unmuting, allowing you to unmute right now.
Okay, good evening. Thank you for giving me the opportunity to speak. I'm Nyejem Kemo Hilary Sigolen from Cameroon, and I would like to know if it's possible to apply, like for someone who is not in an MSA to apply.
Okay, that's the question, Hilary?
Yes, and if somebody just joined the MSA and has never had to like have a post in the MSA, is it possible for the person to apply? Like, is it possible for someone who has not yet had an experience in a medical student association to apply?
Correct. Thank you. Thank you for the question. So I think there are two questions there. So to respond to the first question first, I think there is the participation of different MSAs there is the provision in the constitution. Of course, you have to be affiliated to an MSA. Of course, we have to provide proof that you are a FAMSA member, you are MSA member. So I don't know, because that's why the provision of getting an MSA presidential endorsement letter or introduction letter is there. So I think that to an extent limits you from participation. I don't know if HQ would like to advise that, but I'll let it and if the HQ would like to address that, please they can address that and see how we can go about it. The second question is about you have a post in your MSA, even if you are the president and you want to take part in the standing committee. I don't think like there's a problem with that. You can always participate because these are like different projects. Yeah, so no problem with that. I hope I've answered it correctly. Seguelen.
All
Thank
right,
you for the
thank you
question.
very much, the Vice President. So as regards the question about getting MSA letter from MSA President, yes, it's very important for you to get a letter from your MSA President. If your MSA is currently not registered with FAMSA, you can apply for membership. So thank you very much. We are encouraging people who are yet to be registered with FAMSA to apply for membership. The process is quite easy. So as is process also contained in the constitution, I go to the constitution and see the process of applying for membership for FAMSA. So need an introduction letter from MSA president now to be elected or now to be selected for any position in FAMSA.
Thank you, Dimeji HQ, for the response. Thank you so much. I'll go next to Yusuf and then David.
All right, thank you very much. I don't know if I'm being heard.
Yes, we
Hello?
can. Please proceed.
Okay, thank you very much, Mr. President. First, of all, I don't know if this has been addressed earlier. I want to ask, if someone perhaps have interest in more than one committee, probably that's possible to actually apply as one. Then the other is standing committees. I've been a member of one or two. At least I've been a member of SCUMA, Medical Education and Research, and then the policy implementation. What I have seen over the years is, for example, the last two administration where I was member of the SCUMA, they organized research training for us, workshops. Even some we, pay some amount of money to attend the training. Then afterwards, we don't proceed after. Everything just, died down like that. And I don't know what has been wrong with that. I think it was the time of this Babatunde Abdulhamid when was it the president or so? I can't remember. So please, is there any work going on that? Then I don't know if there is a standing committee that's actually working on, healthcare financing and policy implementation. Some of us have interest around what's it called? Making impacts in the fields of healthcare financing and policy, sort of a new emerging field within the medical ecosystem now. So I don't know if there's a standing committee on that. Then I would like the first question to be addressed. Thank you very much.
Thank you so much, Yusuf. I'll request you to do the first question because my internet broke a bit, and then I respond in just less than a minute.
Okay, thank you. What I was asking of that.
Sorry, you're mute, Yusuf, or
Can you hear me now? I said,
yes.
if perhaps I have interest in more than one community, I don't know if it's possible to actually apply because I don't know, and I don't know if that has been addressed before. So that was the first question, actually.
Okay, yeah. So that we are looking at the representation experience. I think you saw the points we are looking at with regards to experience, representation, gender, region, and all. So while there is no limitation for you to pursue even like more than one committee, we recommend that you follow one committee because then you'll have your full energy focused there and trying to, like, you'll give your best. That is the an encouragement we are trying to give. I think you also highlighted a challenge of receiving certificates with the previous standing committees. If so, I'd like to address that too. Certificates? Hello,
Not
Yusuf?
really about the certificate. Yeah, we get certificates, but then, we come in for workshops. I'm talking about specifically medical education and research. Now, we organize workshops, then we go in for workshops, we do the training, then The last time we were supposed to work with some people to like work on some research paper and probably get it published and then move on in our research, career. But after the workshop, I couldn't get any of it again. Everything just went off till the next administration came in.
Sorry,
So
so
I don't
that's
know if
yeah.
chairman
We
is working around not to allow
yeah.
that anymore.
Okay, so I'll proceed to challenge the standing SCOMA. I think the standing committees you're involved in, please do an email to famsaarchives@gmail.com and then register this complaint, and then we trace down the projects that were happening, because this is normally a handover process, and we'll get back correctly to you, Yusuf, and I'm sure even we can carry on the projects into the new tenure. So I think they might have even handed over the same projects to the new incoming chair person, the standing committees. And then David, please. David, proceed on mute.
Okay.
Okay.
Yeah. Hello. Good evening.
Good evening.
So good evening. So I have two questions. Firstly, I didn't get the play when you talked about the presidency giving you a recommendation. Are we meant to put it in the how are we meant to submit that? And also, I wanted to ask for someone well experienced in the national body, national MSc, experienced in capacity building and training. Is it possible to apply for leadership positions as capacity building coordinator, also in FAMSA, without any previous experience in FAMSA? These are my two questions.
Okay, thank you, David. So the first question you asked about how to submit that letter. So what you do normally is like the president writes for you the letter just to verify that you are belonging to an MSA in the continent, of course, and this will be used for accountability, and the president nominating you means like you are a student. Then from there, you just create a Word or a PDF document, then you upload it. There's that option that you upload a file that is less than 10 MB, I think. And then to answer the next question, I hope I've answered that correctly. To answer the next question, yes, you are welcome to apply. You remember there's a clause I read there that you are encouraged to apply even if you don't have a prior experience. So there's that statement in the instructions, the first page of the application form. Proceed to apply. Thank you.
Excuse me, is it the area for resume to upload the recommendation from my president, or because that's the only place I'm saying apart from the motivation statements place? That's the only place they have something
Sorry.
okay.
Yeah. So there's the option for, I don't know, HQ can try address that. I think we try to alter the form today in the evening for purposes of demonstration. Please, I think HQ will address that, because you are supposed even to put your complete details, name, email, MSA, country, region. So there's that part of the form. Please, you'll have that point of uploading the the MSA introductory letter. So HQ is addressing that currently. Yeah, so I hope this we are able to join WhatsApp groups. We are in different regional committees, different regional leaders. Please, you can paste in the WhatsApp links to join for people to join. And yeah, at any point, if you can find even me on LinkedIn, just inbox me and say, Bon, I need to get there and there. Yeah, so I'll just do that as we focus on trying to increase the mapping of FAMSA and the accommodation in the group. Yeah. Follow any social media and try even comment at the comment section. Yeah. Yeah. So that will be addressed, David. Is there any other concern?
Thank you
Yes.
very much. Thank you very much, Juan, and thank you everyone who asked and shared their questions and concerns with us. There are certain questions in the chat box I want us to go through before anyone else raise their hands to unmute. So the first here is, may someone apply for more than one position, which I believe has been addressed. And if someone who isn't working with the MSA president of this MSA can apply without the remark from the president, which was also answered that you need a letter from your MSA president, and if I may ask, does one apply according to their MSA or that the country they are from? No, you apply from your MSA level, not your country NMO. So from the unit of your MSA, that is where you apply from, and that is if they both differ. Yes, that is if they both differ. How long post graduation is one eligible to apply? I think correct me if I'm wrong, Mr. Bon. Um, the the year you like, if you are a medical student in this year, you are eligible to apply as long as did not start the year as a graduate. If you've started the year as a medical student, correct me if I'm wrong.
Yeah,
Okay.
correct. Yeah, correct. Yeah, okay.
Yes, thank you. And then, would there be an interview we should prepare for? No, you're just advised to go through the constitution and apply for what you are interested in. I think that the head school administrator has already answered. So I think those are all the questions, right? Does one need to know the past tenure of the positions they are applying to? Which the HQ has already replied, no, you are advised to go through the constitution. Okay, I think I've read that. So I think those are all the questions from the chat, and most of them have already been asked and addressed. So
Okay.
okay, I think one person is raising their hand. Would you have anything to say before
Yeah,
the next
I
question?
wanted to thank all the participants. We had like 11 countries represented: Kenya, Nigeria, Tanzania, Togo, Uganda, Zimbabwe, Congo, Sudan, Ghana, Liberia, Cameroon, Mozambique. So please, congratulations, and share to your friends also. I think Ethiopia too. Yeah, Ethiopia. Yeah. So that is like 14 countries.
Okay, thank you very much. I think Johnson
There's South
has
Sudan.
his hand raised. That should be our last question, I think. Johnson, if you have a question, you can unmute your mic, and then after addressing your question, we'll start rounding off for today.
Hi, Stanley and Musa, please. I don't know if we have the questions yet. Musa, proceed. I think Stanley lowered the hand.
Okay, hi, good day. So I just wanted to confirm, you talked about the form being altered. So when can we check back and complete the application?
Hi, HQ, hello.
Hello, good evening. So I really apologize for the issues with the form. You should check back tonight. Okay, this currently 5 p.m. 5:39 p.m. GMT. So checking back in the next 1 hour or 2 hours will have been all the corrections that will have been affected by then.
All right, thank you so much.
Okay,
Okay.
I think
Yeah.
we're
Thank you.
done. We're done with the last question, right?
It has been
Okay.
addressed. It has been addressed. I don't think there's any other question that is. I don't think there's a
Okay.
question that is pending. Yeah.
Okay, thank you very much. our EC members for joining, our members for joining, those that have presented and shared information, those that have listened, the receivers of the information, those that have asked questions, and those that have addressed questions. Each and everyone, thank you very much for taking your time and attention to attend this our session. And I hope after this, after we've cleared all your doubts and questions, we are expecting a lot of applications from African medical students to join and participate in FAMSA, and hopefully we all get the benefit it comes with. So the last item we have is remarks by the Vice President himself, Mr. Bonaventure Matuka. And I forget to mention that the President is also sending his regards to all of you. He wished he could have been here and joined us in this interesting session, but unfortunately, he had to be in transit today. So his apologies to you all. So Mr. Bon, the floor is yours.
Thank you, Secretary. Thank you for the invitation. Yeah, so I don't know, I've spoken a lot, but the only thing I need to thank
Sorry,
you.
sorry, Mr. Bon. Sorry for interrupting you again. The scope chairperson had his battery low when he was called,
Yeah,
so he's now ready to give us. Let's give him 1 or 2 minutes
correct,
to talk about.
correct. No problem. Proceed,
Give us a
please.
bit about scope before you proceed. Sorry for that.
Proceed, Ashley. It's okay.
Ashley, please, the floor is yours.
Thank you so much. I apologize for delaying my presentation. I'd like to first start with introducing myself. My name is Ashley Kamau, currently serving as the chairperson for the Standing Committee of Publications. Briefly, I'd like to describe what our roles entail. We mainly engage in creating content, reviewing and approving the publications for the FAMSA newsletters, as well as managing the social media platforms. So if anyone is interested, please feel free to go through our task descriptions and selection criteria and submit your applications. We look forward to having you on board. And in case of any questions on ScopeUp, please reach out. Thank you.
Thank you very much, Ashley. And now I think Mr. Bond, the floor is yours.
Okay, thank you so much. Yeah, so I think I've spoken a lot. I'm not going even to bother you with a lot of words. In less than 1 minute, I'll be done. So my final remarks, I think there was a testimonial from Dr. Tasniam while she was volunteering in this multidisciplinary collaboration and advocacy and in the FAMSA different committees. This international opportunity found her. So like while we are aligning with these international priorities, this is an important opportunity for you to do your networking. Of course, there is of developing skills. You are able to create impact, and there's that pride of being a medical student, that being able to demonstrate impact. And at the end of the day, is just to drive change. Yeah, so please join the leadership, different committees and technical working groups, play a pivotal roles, of course, in strengthening the medical student voice in our continent. And we'll do our best to offer the best we can also to support you in different committees and different groups as you contribute to health equity and these policies and different projects. So together through these positions and these working groups, we can build a healthy and more equitable future for our continent. That is what I'm looking forward to, and it should be fun. It should be fun. Like, I need to know as many people, so I want to congratulate all the 15 countries now that joined here tonight. And there's a big challenge because that is like less than 25%. If we triple that number, we'll be at 60. So that's 25% of African continent. So Shadrach, please, you can share a link to the likes of Oliver George, who would like to join from South Sudan. And then we work on having a big map. And you can share even your social media links. While we are done, I'll request the secretariat to allow end meet at that is in the next 4 minutes, so that people can try to connect and join different groups. Thank you so much, and I wish you all the best. Please welcome on board. Thank you.
Thank you, Mr. Bon, and those interested can please wait a minute for our social media link to drop so that you can follow. But for now, I think we're officially done with our Q&A sessions. Congratulations, everyone. So, please, Ashley, can you help us with our social media link? In the meantime, while we wait for it, Mr. One, can you continue or complete your interesting story before we start? I've already started getting like interested in. I myself, I've already started feeling interested. Or okay, what does he have to say? When I was asking the question about volunteering experience in FAMSA.
Yeah, actually, my experience was quite interesting because even the point of getting myself at the WHO regional committee, I would never have thought of it because I was in the FAMSA Policy Advisory Council. I remember I'd interacted with the previous EC, and while following the pages, I applied for a post in the Policy Advisory Committee. So I'd drawn my expertise directly from the UN. I honestly wasn't ready to work with FAMSA. I never knew about its existence. And yeah, so then I went to the Policy Advisory Committee. We trained people on how to come up with good policies. Testimonial Teresa was in there. We had other people. I think I saw Omasuzi also from Nigeria. She was there. So there are other people who are there in the Policy Advisory Council and the policy training sessions. Yeah, then from there was a chance now from the Afro Secretariat who is going to represent us in the WHO Regional Committee for Africa in August. Then yeah, I was there, but then at the moment I was never prepared to travel. This is like you need close to a range of up to 1,000 to 1,500 USD in a span of 1 week for you to travel. So yeah, I ended up being the only one who was traveling. So I wrote like a travel grant to my institution and research center that is around here because I've done a research around climate change and public health and sickle cell patients, and then I used that to get a grant allocation. And yeah, then when I reached there were elections, the nominations, and I remember the Tanzania people forcing me to sit because Kenya now didn't want to come to the campaign days, first day and second day, because there was a Rwanda and Tanzania nomination, and of course West Africa, there were countries. So yes. Sorry. Yeah. So then somebody forced me to sit on the seat for Kenya. So I was quite inspired, and yeah, that's how I got to know the Kenyan ambassador, to connect with different people at the committee. Then those networks, I just want to paste them here FAMSA to benefit the Federation, to benefit different MSAs in Kenya. Thank you. I think I'm done. I'll proceed to adjourn the meeting and wish you good luck and wish you blessings for those who believe, and wish you an amazing week ahead and all the best in your applications. Thank you so much. See you next time.